Pregnancy and arthritis are two of the most common things people don't talk about. When you're pregnant and have arthritis, there's a lot of things that can be challenging. But in today's video, we're talking about pregnancy and arthritis and what you should know about this condition. Two topics that aren't discussed about enough but are really important for anyone who's pregnant or has any kind of joint pain, because they could be an indicator for something more serious like osteoarthritis or rheumatoid arthritis. So let's dive in. Disclaimer: this content is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please consult with a physician with any questions that you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you watch in this video. We strive for 100% accuracy, but errors may occur, and medications, protocols, and treatment methods may change over time. Arthritis is a term that refers to rheumatic disorders that affect the joints and produce inflammation, discomfort, and stiffness. Osteoarthritis and rheumatoid arthritis are the two most frequent kinds of arthritis. Osteoarthritis, commonly known as degenerative joint disease or wear and tear arthritis, develops over time as the cartilage that surrounds joints deteriorates. Rheumatoid arthritis is an inflammatory illness in which the immune system assaults the joint lining, frequently on both sides of the body simultaneously, resulting in painful swelling and bone degradation. While osteoarthritis does not affect fertility or the baby during pregnancy, it might exacerbate joint discomfort as your body is put under more strain by the growing baby. On the other hand, rheumatoid arthritis can adversely affect fertility, pregnancy, and the postpartum period. Maintaining control of your rheumatoid arthritis with the assistance of your medical team will help you avoid difficulties and increase your chances of having a healthy baby. Infertility and trouble becoming pregnant have been connected to rheumatoid arthritis. According to a 2019 study, 42% of females with rheumatoid arthritis need more than 12 months to conceive, compared to 12% of the general population. In men, rheumatoid arthritis has been shown to impair fertility. Subfertility has been associated with rheumatoid arthritis drugs such as sulfadine, sulfasalazine. Subfertility is defined as diminished fertility for an extended period during which conception does not occur. The medicines may result in a deficiency of sperm or a decrease in sperm motility, or sperm's ability to swim normally. Subfertility has been associated with the use of nonsteroidal anti-inflammatory medicines, NSAIDs, such as Advil, aspirin, and Aleve in women with rheumatoid arthritis during the periconceptional phase, which is the time between conception and birth. Having a better understanding of your issue will assist your overall health as well as your pregnancy. Women with well-controlled rheumatoid arthritis have healthier pregnancies and newborns than those with active disease at the time of conception. It is suggested that rheumatoid arthritis be treated for 3 to 6 months before trying pregnancy. Pregnant women with uncontrolled rheumatoid arthritis may be at an increased risk of problems such as premature birth and having kids that are too tiny for their gestational age. It is critical for people with rheumatoid arthritis to plan their pregnancy with the assistance of their rheumatologist and obstetrician. Now, here is the question that rarely people talk about. Can arthritis get worse during pregnancy? Pregnancy increases the chance of greater pain and symptom worsening in pregnant women with various kinds of arthritis. For example, weight growth can put strain on the knees, a change in posture can put pressure on the back, and higher hormonal levels, such as relaxin and progesterone, cause joints to loosen in preparation for delivery. Pregnant women with unmanaged arthritis may also face difficulties, including preterm birth and smaller than normal kids. The risks associated with arthritis have been connected to active disease and the use of corticosteroids, which are synthetic anti-inflammatory medicines that mimic the hormone cortisol. If you have rheumatoid arthritis, you may be wondering whether it can get worse during pregnancy. In general, arthritis symptoms are milder during pregnancy than they are during any other time. Taking nonsteroidal anti-inflammatory drugs, or NSAIDs, during the third trimester can prolong labor and cause pulmonary hypertension in the newborn. In addition, the stress of being pregnant can make a woman's fatigue and back pain worse. The weight of a growing belly can also put more pressure on the joints, which can lead to more problems with breastfeeding. Women with inflammatory arthritis should speak to their doctor about their condition before they begin a pregnancy. Some medicines can make the disease worse. As the uterus expands, heartburn becomes more of a problem. If the mother experiences constipation, she may need to reduce her dose of NSAIDs and corticosteroids. As a result, it's important to work with a medical professional to develop a postpartum treatment plan. Pregnancy and arthritis are closely linked. While some women experience remission during pregnancy, others experience flare UPS 2 to 8 weeks after giving birth. Because of this, women with inflammatory arthritis may want to consider a postpartum treatment plan to address their pain and ensure that they can breastfeed. During pregnancy, it's important to conserve energy as much as possible. The extra time and energy that a woman needs to care for her baby will increase the amount of energy she has. After the birth, the days following the delivery are often hectic, exciting, and exhausting. In addition, rheumatoid arthritis may cause joint pain, stiffness, and fatigue. It's important to work with a rheumatologist so that the condition can be controlled and the baby will not be harmed by it. A pregnant woman may also want to increase her exercise and practice range of motion exercises to keep her joints flexible. If you are pregnant, you should consult your doctor about your arthritis medications. You should avoid taking medicines unless you have a clear plan. If you can breastfeed, you should not hesitate to continue with the medications you need to take. Your body needs to rest, and a woman's joints need to be as flexible as possible. While arthritis can make you feel fatigued during pregnancy, it isn't a cause for concern. If you have rheumatoid arthritis, you should consult with your doctor before getting pregnant. Taking any medication will increase your risk of developing a birth defect. However, there is a good chance that the symptoms will improve during the pregnancy, so you should be sure to follow your physician's advice and talk about the condition with your prenatal practitioner. If you're already pregnant, you should consult with your rheumatologist for your arthritis. If you are already taking prescription medication for rheumatoid arthritis, it is important to talk to your primary care doctor to discuss the pregnancy risk with your rheumatologist. Your doctor will also help you decide which medications to take. And your obstetrician will recommend the appropriate dosage. Certain medications can make rheumatoid arthritis symptoms worse during pregnancy. Some of them should be avoided entirely. Those that are prescribed for rheumatoid arthritis should consult their rheumatologist. While these medications can be safe to take during the first trimester, they should be stopped at least 6 months before conception. If you still need medication, you should talk to your rheumatologist. Pregnancy is a time of great joy and also can be difficult to manage, especially for people with arthritis. While there are many precautions that pregnant women should take while they are expecting, it's important not to forget your medications. If you have questions about how best to deal with pregnancy and arthritis during this special time in life or need help managing both conditions simultaneously, talk to your doctor today.